Hello, I'm Richard Stewart, and I'd like to welcome you to TV20's Cleveland Health, our program dedicated to discussing and educating our community about critical health topics that directly impact Cleveland neighborhoods. Each episode is designed to inform, empower, and connect you with valuable insights and resources to address the pressing health challenges facing our city. Thank you for joining us as we explore these important issues and work together to build a healthier, stronger Cleveland. Today on TV20's Cleveland Health, we're covering a range of important topics, including valuable resources available through the Northeast Ohio chapter of the Red Cross, kidney health awareness, as well as women's health. In recognition of Red Cross Month, we'll visit the Northeast Ohio chapter to explore the services and options they provide to the community. We're also shining a spotlight on Dr. Lauren Griebel, who will discuss critical issues affecting women and share insights on where to seek help if needed. But first, we visited Cleveland's Minority Organ and Tissue Transplant Education Program, or MOTEP, where we spoke to Executive Director Linda Kimball about the vital resources the organization provides to the community. We also had the privilege of hearing the powerful stories of Pastor David Cobb, a kidney transplant recipient, and Tanya Howard Grace, a living organ donor, as they shared their personal experiences and the impact of organ donation. Cleveland's Minority Organ and Tissue Transplant Education Program, or MOTEP, is committed to raising awareness about the vital need for organ and tissue donation. They're primarily focused on minority communities and were established to address the disparities in organ transplantation that exist across various demographic and socioeconomic factors. Cleveland's MOTEP continues to be a powerful advocate for equitable healthcare access and improved transplant outcomes, while ensuring that more lives are saved through education, outreach, and community engagement. At the Centers for Dialysis Care, patients undergo life-sustaining treatments, many due to chronic conditions like high blood pressure and diabetes. It's a reality MOTEP is working to change.
There's a prevalence in our community of diabetes and high blood pressure. I would hazard a guess if you were to talk to some of the patients, they would say they had out of control high blood pressure, out of control diabetes, and that's the reason why they're dialyzing today.
Education is at the heart of MOTEP's mission, and for Linda Kimball, it's personal.
So here I am, almost 13 years later, and doing what I feel like I was put on this earth to do. And the programs that we actually implement at Cleveland MOTEP is, I think, improving what the health and wellness of individuals and also saving people's lives.
For those in need of a transplant, finding a donor is often a long and difficult journey. But for Tanya Howard Grace, there was no question when her best friend needed a kidney. She stepped up.
A best friend of mine about 10 years or so ago unfortunately found out she had kidney failure for the second time. So I reached out to the clinic and started asking questions of what did it take, what did it mean, what would happen, and I just started the testing process. I didn't talk about it a lot because I really didn't want anybody to try to convince me that this was not something I should do. And the more and more I thought about my friend, I thought, God is just aligning me.
For those waiting to get that call that a match has been found is life-changing. Pastor David Cobb remembers exactly where he was when he got his news.
I said, wait a minute, let me answer this. And so they said, hey, guess what? We got a kidney for you. And I'm out there, you know, music's loud and everybody's thinking, oh, he's having a great time. But I was jumping and just jumping and dancing because I was so excited that I was getting ready to get a kidney. So I was, again, it was some of the best news that I had ever heard of. I had a chance to write a letter to the family of my donor. I also wanted to let them know that I believe in and I take serious this precious kidney that has been given to me, and let them know the wonderful things that I've been able to do. The kidney that was given to me and the gift that was given to me was not wasted.
MOTEP is not just about organ donation, they're also about prevention. Chronic illnesses like hypertension and diabetes are leading causes of kidney failure. Their mission is to educate the public about how to prevent these diseases before it's too late.
We're telling people about chronic kidney disease, talking to people about high blood pressure and also diabetes, which is correlated with kidney disease. And we know in communities of color, sometimes that's very low on their totem pole of what they're thinking about. So that's why I'm doing what I'm doing.
And for those who are hesitant about becoming organ donors, Tanya Howard Grace has one simple perspective to share.
I just feel like you have organs, but if you believe in faith, once you leave, you don't take them with you, so you might as well let somebody else use them.
For Pastor Cobb, signing up as an organ donor is an easy step that can make all the difference.
When you go to the bureau, and the driver's bureau, that you make sure that you mark and tell them that you want to be a donor.
Whether through education, prevention, or the life-saving decision to donate, MOTEP is making an impact, one life at a time. If you'd like to learn more about organ donation or MOTEP's programs, visit clevelandmotep, that's with 2Ts.org. Up next, we'll sit down with Dr. Lauren Griebel from University Hospitals to explore critical women's health topics, including uterine fibroids and endometriosis, and their impact on overall women's well-being. And later, we'll take a closer look at the Red Cross and the vital resources they provide to the community. Stay tuned. It's all happening right here on TV 20.
Hello, I'm Scott Osicki, Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. We know that life can be overwhelming, but you don't have to face it alone. If you or someone you know is feeling anxious, depressed, in a mental health crisis, have alcohol or other drug use concerns, or just need someone to talk to, help is available. Call or text 988, the Suicide and Crisis Lifeline. It's free, confidential, and available every day 24/7. Trained and caring counselors are there to listen, support, and help you find hope no matter what you're going through. Remember, you're not alone. Call or text 988 anytime because your mental health matters, and so do you.
Hello, I'm Michelle Princeton, and I'm a licensed social worker working for the Social Support Service Unit out of the Mayor's Office of Prevention Intervention Opportunities for Youth and Young Adults. The City of Cleveland has demonstrated a long-term commitment to residents working to create safe spaces in our neighborhood resource and recreation centers where families can access free resources and support services. We are committed to working together with families and other community providers to identify and help families who are struggling to achieve a better quality of life. To access the social support services, leave a message at 216-664-2223 and a team member will return your call. Our work includes referring individuals to appropriate services such as medical, hospital-related, long-term counseling, public assistance, veterans benefits, Social Security, Medicare, Medicaid, food stamps, housing assistance, Head Start, and student loans. We also provide support and guidance for youth and young adults in addressing stigmatization, scapegoating, labeling, bullying, substance abuse, and unhealthy relationships. Once again, to access social support services, leave a message at 216-664-2223 and a team member will return your call. Thank you.
Welcome back to TV 20's Cleveland Health. I'm Richard Stewart. As we celebrate Women's History Month, we're highlighting some important health topics that impact specifically women. Joining us today is Dr. Lauren Griebel from University Hospitals, here to talk about uterine fibroids and endometriosis. Thank you, doctor, for joining us.
Thanks so much for having me.
Tell us, what are uterine fibroids and how do they affect women's health?
So uterine fibroids are tumors that grow out of the muscle wall of the uterus itself. They're typically benign, meaning that they don't cause cancer, but despite that, they can cause a lot of other problems for women. For instance, fibroids can make periods extremely heavy, sometimes so heavy that patients even require a blood transfusion. They can also cause a lot of pain and cramping with periods, meaning that someone might not be able to go to work or do their sort of normal activities. And lastly, over the course of a woman's life, fibroids tend to grow in size, and they can get big enough to cause what we call bulk symptoms, so low back pain, pelvic pain, things like that from just the extra pressure and weight in the uterus.
So what should women look for? What are the common symptoms when these are first developing, and when do they know how to, when to act?
Sure. So the most common things that we see with fibroids are very, very heavy periods or very, very long periods. We also see a lot of pain. So if your periods are so uncomfortable that you can't go to work or school, etc., that's not normal. Or they may notice chronic low back pain, chronic pelvic pain. Really, because fibroids can kind of start causing problems slowly and then get worse and worse over the time, if at any point a patient has a concern, it's reasonable to request a pelvic ultrasound and to talk to a healthcare provider.
Are there certain risk factors or pre-existing circumstances that would make a woman more susceptible to developing fibroids?
Absolutely. So we still don't know exactly why some people get fibroids and others don't, but we do know there's a genetic link. So if your mother or aunt or other family members struggled with fibroids, you're more likely to struggle with them yourself. They also tend to be more common in our Black patients. And then there are a few risk factors as well that we actually have some control over, like our diet, our weight, and low vitamin D levels. The best way to mitigate those risk factors is to exercise, eat a healthy diet with lots of fruits and veggies, minimize red meat, and get your vitamin D levels checked. If you're low, take a supplement.
So March is also Endometriosis Awareness Month. Talk about what that is and what folks should know about it.
So endometriosis is a condition where tissue similar to the tissue lining the inside of the uterus actually develops outside of the uterus. We most commonly find it in the pelvic tissues, but it can affect other organs like the bladder, the bowel, and the ovaries. During a menstrual cycle, endometriosis tissue becomes very, very inflamed and irritated, which can cause debilitating pain during a period, but also over time, scars or sticky tissues to develop within the pelvis itself.
What type of treatment options are available once you've already developed endometriosis?
There are actually a lot of good treatment options. We don't yet have a cure, but there's lots of different medical and surgical options for managing the symptoms from endometriosis. Medical options typically involve some type of birth control or related hormone medication. A lot of patients have concerns about use of hormonal medications, which is completely understandable, but there are actually a lot that are very safe and effective. Now, from a surgery perspective, it's often removed that as endometriosis is causing problems, we go in and surgically remove that tissue. That can help with pain symptoms, and it can actually help improve fertility for some patients as well.
When it comes to fertility, how do each of these conditions affect a woman's ability to conceive, and what should they do about it?
Sure. So fibroids and endometriosis can both impact fertility, making it difficult for a woman to become pregnant, or in the case of fibroids, sometimes difficult to maintain and further develop that pregnancy. When that's the case, surgery is usually recommended to remove the affected endometriosis tissue or the relevant fibroids.
And lastly, what should women do who are already struggling with this? What's the best way to manage the symptoms?
Managing the symptoms starts with talking to a healthcare provider about them. Like we said, there's a whole host of options available, and what's right for one patient may not be right for another patient. So it's important that patients speak up for themselves if they think that their periods are abnormal, and it's important that healthcare providers listen to those concerns and take them seriously.
Well, Dr. Griebel, thank you so much for joining us and sharing your advice on this very important topic.
Of course, my pleasure. Thank you for having me here today.
Absolutely. Coming up next on TV 20, we'll take a visit to the Red Cross and speak with Christy Peters. She's Northeast Ohio's Regional Director of Communications, who will share valuable resources available to you at the Red Cross. We'll also hear from generous donors who support the organization. Stay with us. We'll be right back after these messages.
At Cleveland Rape Crisis Center, we believe that everyone deserves to feel safe, supported, and heard. For over 50 years, we have been here to help survivors of rape, sexual abuse, and human trafficking rebuild their lives and to prevent future violence through education and advocacy. Our services are confidential and always free of charge. We provide 24/7 crisis and support hotline for immediate help, individual and group counseling to promote healing, specialized services for children and families, advocacy and legal support to navigate complex systems, prevention education to empower communities, resources and support for deaf and hard of hearing survivors through our Deaf Pathways program, and drop-in center for the on-spot assistance. No matter what you're going through, you are not alone. Call our 24/7 hotline at 216-619-6192 or text 216-619-6192 or visit clevelandrapecrisis.org to chat with a trained professional. Help is here and healing is possible. Together, we can make a difference.
Welcome back to Cleveland Health on TV 20. Recently, we visited the Northeast Ohio chapter of the Red Cross, where we spoke with representatives and donors who highlighted the vital services the organization provides. Every day, the American Red Cross provides life-saving services, including disaster relief, training, and blood donations. But none of it would be possible without volunteers and donors.
90% of the work that's done by the American Red Cross is done by volunteers. Without volunteers, we cannot accomplish our life-saving mission. So during March's Red Cross Month, we are highlighting the important work that all of our volunteers do, and we're encouraging more people to get involved.
One of the biggest needs? Blood and platelet donations. For many, donating is a way of giving back in a meaningful way.
It was actually a Facebook post of a friend of mine who said, times are crazy right now, and what can you do, when you're feeling, kind of helpless about the situation in the world. He said, you can always try and help other people. So he said, one thing you can do is donate blood.
For Scott Crawford, a longtime donor, giving platelets became a passion after learning just how many lives even a single donation could touch.
I was already in the process of donating when a representative from the Red Cross came in and handed me a flyer about platelets. And we had a conversation about the benefits of platelets and how many more people you help by every donation. Up to, I believe, five people can benefit from one donation.
And every now and then, donors get a special reminder of the human impact and the difference they make in the lives of others.
We had a whole blood donor come in, and she had wrote a poem about what we do. That when she came in to donate today, she read the poem to us about collecting blood, about the American Red Cross, about the nurses that work here and the staff that work here. That is what's rewarding to me.
Here in Northern Ohio, the American Red Cross needs to collect 500 units of blood per day to meet the needs of more than 70 local hospitals. To do that, they run between 15 and 20 blood drives per day throughout the 31 county region they serve. And while blood donations do save lives, Red Cross volunteers also provide critical aid during emergencies, responding to disasters throughout the entire country.
We have volunteers right now who are still helping in the recovery from the wildfires in California. We also still are in Kentucky helping people who were affected by the massive amounts of flooding that happened last month.
With so many ways to help, donors like David Payne say it's an easy way to make an impact.
There's no reason not to donate blood. If you're looking for something you can do to help somebody else, it's easy, it's simple, and it's just a good thing to do.
Whether through blood donations, disaster response, or life-saving training, the Red Cross continues to be a beacon for hope. If you'd like to donate blood, volunteer, or get involved with the Red Cross, visit redcross.org. Well, that's it for today's edition of Cleveland Health on TV 20. We hope you learned something that could help you or a loved one live a healthier life. I'm your host, Richard Stewart. Thank you for joining us.